Hello everybody, I am Dr. Senthil Kamalasekaran, Senior Consultant at Chennai Ortho Clinic, and today I am going to talk to you about IT band syndrome or pain on the outer side of your knee. IT band syndrome is a condition which is very common and affects runners and cyclists. However, it is different from the runner's knee, in which you have pain in the region of your kneecap. In this condition, the pain is located on the outer aspect of the knee. So, if you take your knee joint, your knee has your thigh bone, your leg bone and the kneecap, and the runner's knee mainly affects the undersurface of the kneecap. Whereas in IT band syndrome, you have a band which is running from your pelvic bone to the outer aspect of your knee, and because this band gets very tight, it causes a friction when your knee is bending and extending and can cause pain on the outer aspect of your knee. This is purely a clinical symptom. You cannot diagnose it by taking an X-ray. If you need to diagnose this, you might have to take an ultrasound of the knee to demonstrate any kind of fluid in that region, or you have to take a MRI scan of your knee joint. Once we have diagnosed the problem, the treatment depends on how we can actually rehabilitate your knee, and we have to give you rest. So if you're an avid runner who runs marathons, or you're a cyclist who does long distance cycling, we need to make sure that you cut down your training time, you take rest from the problem, make sure that the problem resolves, and then slowly restart training so that you can get back to fitness. So rest is the key. Sometimes some people have some crepitus also when they are running or when they have this problem. Seeing a physiotherapist and doing IT band stretches. There are lots of stretches available, and the physiotherapists are very good in releasing this very tight IT band. So doing a lot of stretches can actually help take away the pain on the outer aspect of the knee joint. Sometimes this pain can also extend up to the hip and cause inflammation in the outer aspect of the hip and can cause a condition called as bursitis. So that can also be associated with this tight band. So once you have this condition, make sure that you rest, take adequate amount of physiotherapy, and if that doesn't work, then we have to go in for injections. So injections, what kind of injections can help you? Normally, we give a shot of cortisone along with local anesthetic into that particular area, and we do a percutaneous needling technique in which we actually take away the tension on the tight fibers of the IT band so that you can actually get going immediately after the procedure. So if you are not responding well to conservative methods like tablets, physiotherapy, then you can try this ultrasound guided injection of cortisone, or even you can take a PRP shot. So PRP is a platelet rich plasma in which we actually take your own blood and we harvest the growth factors and we give it in that region of inflammation, and that promotes healing of the region of the IT band where friction occurs. So after this, you take a period of rest and then slowly rehabilitate yourself back to fitness. So all those runners and cycling enthusiasts, if you have any pain on the outer aspect of your knee, just take care of it. It might be an IT band syndrome, and see your doctor and get well soon. I hope this short video can give you some kind of enlightenment into what this condition is. If you like this video, please like, share and subscribe. Thanks.